Thank you, Dr. Miller, for the introduction. And I thank the Nobel Fund for funding us to do this project. So my talk is about a therapeutic liver targeting nanoparticles for peanut allergy and anaphylaxis. So the anaphylaxis is a severe form of allergy. So what you may wonder, what has the liver to do with these allergic diseases? So the liver has some secrets over here that the transplantation, the doctors, when they transplant organs to the patients, what they found is when they transplant the liver with the other organs, that you can use less immune suppressants. Well, if you don't have the liver, the kidney or liver or lung transplantation, we use a lot of immune suppressants. So increasingly, liver has been recognized as has important immune functions. That this is due to their unique location. They're dealing with the bombardment of the food, foreign food proteins, and the bacteria. So they develop a natural immune tolerant environment in the liver. And the mechanism involves, the generation of the T cells. The liver has the ability to induce the naive T cells into the regulatory T cells that can travel around the body to tamp down the immune responses. So how do you access the liver to access their immune tolerant environment? So we use the PLGA nanoparticles. So the liver has a unique structure in their microlobules, and the blood, when they go into the liver, the blood pressure drops, the blood flow slows. Then the nanoparticles have ample time to interact with the cells in the liver. And one of the important functions of the liver, they have many cell types that play important role in the immune tolerance. One of them is called the liver sinusoidal endothelial cells. So once the particle get into the liver, the LSACs can actively take up these nanoparticles and present the antigens to the naive T cells. So the T cells can differentiate into regulatory T cells, secrete TGF beta, these immune tolerant cytokines, then inhibit the allergic responses. So the first disease we try to target is the food allergy. The food allergy, you may know that it's affecting 50 million Americans, and 1 in 13 children are having food allergies, and it's increasing also rapidly. There are 8 most common food allergies, including milk, tree nuts, peanuts. Among these, peanuts is attracting most attention because it induces the most anaphylactic or the severe form of allergic responses. So currently, there are no cure for food allergy. Just last year, the first FDA-approved drug, Palforzia, is approved for treating peanut allergy. This is an oral immune therapy, so it can reduce allergic reactions, and it provides a desensitization of the patients to the peanut. However, you have to take the medicine every day, and you have to continue to practice food avoidance. It doesn't give you long-term tolerance. And this drug is consists of the crude peanut extract, which can still trigger the anaphylaxis in the patients. So the patients had to stop this immunotherapy. So the crude peanut extract belongs to the current state of art immunotherapy. However, as I mentioned, they may introduce still the anaphylaxis because the crude extract contain multiple proteins that can still trigger the allergic responses. So now people are developing the next generation allergen immunotherapy. So they use recombinant proteins or they use the T cell epitopes. So what is an epitope? Epitope is a fragment of the protein that can be presented by the MHC2 molecules, and specifically in the liver, the IL-sac, the endothelial cells can take up the particle that combining with these epitopes present by MHC2 molecule and trigger this differentiation of the naive CD4 T cell. Then they differentiate in the regulatory T cells to treat allergy. And you can also develop, a nucleic acid form of these epitopes or proteins, to make this treatment. So how do you start? A peanut has 17 major peanut allergens. You cannot use all of them for this T cell epitope, treatment. So we focused on the ARO-H2, one of the major protein that about 80% of peanut allergic patients have response to. And how do you determine the epitopes? Currently, there are several databases available. The tools can be used to predict the epitopes. And using these IEDB, developed by the NIAID, we use these tools to predict our, MHC2 T cell epitopes. And using the IEDB database, we got 4 candidates. That's our step 1. And for step 2, we synthesized these epitopes, these little peptides. As you will know, that the peptides will carry a charge, and they have different hydrophobicity that will influence their dissolution in the aqueous phase to prepare for the nanoparticles. So using these parameters, we selected this epitope number 4. As you can see that they have a negative gravy value, the hydrophobicity value, and they have a charge when they are present in the solution. And you can see that the number 4 has the highest loading capacity of 8.68. And using these number 4 peptides, and the RH2 recombinant proteins, purified protein, we prepared the PLGA nanoparticles. This nanoparticle has a polymer shell, and the inside are the antigens and epitopes. On the surface, we modify this with a ligand. It's ApoB 100, a peptide that can specifically bind to the receptor, scavenger receptor on the IL-sac cells. These particles are about 200 nanometer in size, has a negatively surface charge. You can see the SEM images of these particles, uniform in distribution. So we tested the effects of these nanoparticles containing those little peptides and proteins in the peanut oral anaphylaxis model. So this model is mimicking the human peanut allergy disease, by taking up, we inject these crude peanut proteins by oral gavage. So the animals, after sensitization stage, they can develop this, response to the peanut proteins when you challenge. Then we monitor the body temperature, the anaphylactic symptoms, as well as other parameters. We compared the crude peanut protein extract and the purified IRH2 protein with the IRH2 epitope, the number 4 epitope I talked about. From this slide, you can see the dramatic results. That the red bar is the crude extract positive control, that the animals have a drop of a whopping 6 degrees of their body temperature. However, this epitope one, the green one, you can see they don't have a temperature drop. They're similar to the control, and they are much better, in protecting the animals than the crude abstract containing nanoparticle and the purified IRH2 protein containing nanoparticle. And the symptom score also showed the same trend. On the epitope treated one, you can see that the 5 animals actually has no allergic response. Only one has a minor response. And the mast cell release, a biomarker of the allergic diseases, you can see the same thing, that the epitope containing nanoparticle returned this parameter to the control levels. So in the next year, what we are going to do is to further, make improvement of our therapy. We want to assess the durability, dosage, and the duration of this, treatment. We'll compare the effects of this number 4 with other epitopes, including, from the other peanut proteins like IRA6. And we'll explore their mechanism of this tolerance, and we'll scale up the production of the PLGA nanoparticles. So we're also ready to translate our, animal results to the human peanut, allergy. So the human, as you know, is a much more complex than the animal models. We have, HLA2 restrictions, meaning different person have a different preference of binding to the T cell epitope. So we predict that we'll use multiple epitopes for this human treatment. And these epitopes can be predicted again by those tools I mentioned, like IEDB database. Then this will generate a series of 15 to 20 mers, the peptides. Then, as I mentioned, there are some limitations on this, solubility of the peptides due to the charge hydrophobicity. So we will also develop the nucleic acid based, treatment to, express these peptides in the cell. So we don't have to, deliver these peptides to the cells. So these epitopes will not bind to the IgE to trigger the allergic response. They don't trigger anaphylaxis. However, they can trigger the T cell proliferation, especially the regulatory T cell proliferation. So on the scale up front, using our nano assembler, we have synthesized the PLGA nanoparticles. So this system uses a microfluidic system. They have two streams of the materials. One is a solvent containing those PLGA polymers, and the other containing the epitopes and antigens. So they mix together to form this PLGA nanoparticle automatically. On the mRNA delivering lipid nanoparticle front, we also use the same system to synthesize our in-house mRNA delivered cationic lipid nanoparticles. As we know, we currently have this mRNA-based, COVID-19 vaccines. So you can see we have the similar nanoparticle structures. You can see the crystalline structures that are the mRNA binding with the cationic lipids. So I think we are sitting at this inflection point that we are ready to translate our technology to the clinic, and similarly to the peanut allergy, we can work on other allergic diseases like the dust mite allergy, cat allergy, or the therapeutic antibody induced this phenomenon called the anti-drug antibody that can limit those antibody drugs, the effectiveness of these drugs. So our approach would be able to, eliminate these, reactions to these antibody drugs. Also, we are venturing into this autoimmune diseases. For example, the type 1 diabetes, collaborating with Dr. Manish Bhoot, who is an expert in type 1 diabetes. In the School of Medicine, we used one single, dominant T cell epitope that can completely inhibit the advent of the diabetes in the animal models. So that's really exciting results we are getting. So now I think we are welcoming any collaborative opportunities that we are welcoming, researchers to join us to treat the allergic or autoimmune diseases. So now I conclude my talk, and thank you very much for your attention. I'm happy to answer your questions.